trust your ankle. Trust your offensive line. Trust your coach. And most of all, if Cooper's open, give him the ball.
I got bones. I got bones. I got bones. I got bones. I got.
Hey guys, did Derek Carr look timid to you? I thought he did. Now, I don't know what's going on, but there could be a couple things. I know you guys know he's had an ankle fracture that he's recovering from. He's also had a back injury he's recovering from. Let's talk about the ankle and let's try and understand what could be happening. So this is an ankle. What happened in that play, December 2016, when Derek went down on the field? We all saw it.
The thing is, if whatever for his hope, his foot did release, it finally got out of the ground.
There was a lot of video footage that started coming out, and it's hard to say what exactly happened. Obviously, not everything is released about the ankle fracture, or the x-rays, or the specific mechanism of injury, because there was a lot of legs around that area where his right ankle went over. We don't know if it turned in, turned out. There's a lot of speculation out there. But what I can tell you is that there are certain mechanisms of injury for the ankle. So, your foot, these are your toes, midfoot, this is your ankle. So, an ankle can go out with a little bit of pronation, eversion. You can actually supinate, external rotate. You can actually turn it in and invert. Now, if you imagine the forces acting on this fibula, tibia, fibula, that's the bone Derek broke. We don't know exactly where. People compare it to Mariota and think he had a high ankle sprain, but we don't know. It hasn't been released out in public yet. But we know he broke the fibula. Did he break it below the syndesmosis? Syndesmosis is a little ligament stability between the tibia and fibula, or did he break it above? Did he fracture the tip, or did he fracture right at the level of the ankle joint? We don't know. Depending on the type of injury, and people think it was sort of a twisting injury. His foot was planted and he rotated in, and that caused the fibula to go out. Or did he roll it over and go over on his ankle and break this fibula? It's not clear. But when you break the fibula, you need surgery sometimes, and then once it heals, it takes time to recover. So I know what you're thinking. Doc, he's already healed from this. Why is he playing timid? That's a good question. Okay, so we know, and you all know this, fear of re-injury. That's probably the biggest thing. Yes, he's healed, but he's probably afraid he's going to hurt it again. Maybe he's eliminated that. Mental game, maybe it's out the window. Well, next thing, it's the possibility that there's a disconnect in his proprioception. So that means he's going here, and he's not sure exactly where his ankle and foot are planted relative to the space that he's around. That's proprioception. It takes time to get that back. Muscle, nerve, coordination, understanding where the joint receptors are and their feedback to you. So you may think you can move a certain way, but he has to relearn and remember that his joint may not be moving exactly the way it used to. Another reason, he may still have some pain and stiffness. So he could have a little bit of pain when he does something, so he just backs off a little bit. He may be like 80%, or he's like 70%, or maybe he's 95%. This is Derek Carr, come on. He's probably 105%, but he's not 125% from what he was 2 years ago before the injury. So let's get in the game. He's playing, he's moving, and all of a sudden he feels a twinge. He doesn't react to it. It's all up here. He says, I'm not going to let this pain bother me. He still tries to push through it, but he's not 100%. Those are some of the factors involved. And then, of course, there's the thing that everyone talks about, the psychology of sport. There is so much pressure on this guy that he may be a little anxious, and he's trying to work hard and get back to the game so you, Raider Nation, can win those games. So, Derek, trust yourself. I know you do that, but trust your ankle. Trust your offensive line. Trust your coach. And most of all, if Cooper's open, give him the ball.
I got bones. I got bones. I got bones. I got bones.